Hello, good afternoon, everyone. Welcome to COVID-19 Vaccines, Your Questions Answered. My name is Dr. Julie Drodu, and allow me to introduce the rest of the panel. So we have Dr. Amal Paul. He's a GP and Clinical Director of Vermontoft's Hare Hills and Richmond Hill Primary Care Network. We have Dr. Lucy Jackson, who's the Chief Officer and a Consultant in Public Health. We also have Dr. Nadia Addison, a GP and also Clinical Director for Vermontoft's Hare Hills and Richmond Hill Primary Care Network. And we hope to also be joined by Dr. Mo Sattar, who's also a GP in Leeds.
Right, well, before we get on to the vaccines, we'll talk about what is COVID-19. So I think this is an illness that we've become familiar with over the last 12 months. And I would say that most people infected with the COVID-19 virus, they may well experience maybe a mild or a moderate illness. But we know that there are some people who are at higher risk of developing a much more serious illness. So we know that our elderly, people who are living with other medical conditions such as diabetes, high blood pressure, cancer, those people unfortunately are at higher risk of developing a much more serious illness. Next slide, thank you. So it is a new virus. It's only been known for just over 12 months. But we are now familiar with sort of the main symptoms. These are a high temperature, a new cough, and a loss of change or taste or smell. So people who have this virus will often develop at least one of these symptoms. Thank you. So as well as the vaccine, we know that how to reduce the spread of COVID-19 now. We know that washing your hands, wearing a mask or a face covering, and limiting your contact with others and keeping that social distance is one of the best ways that we can to reduce the spread and reduce the transmission of this new virus. But we know that as well as the viral, this has really impacted everyone living in the UK and around the world. Very sadly, 110 or over 110,000 people now have lost their life. And I'm sure the rest of the panel would join with me in expressing condolences to anybody who is grieving at the moment. And we know that over 200 frontline health and care professionals have contacted this virus and sadly ended their lives. All of us have made sacrifices, and we are seeing not only emotional impacts of this virus, but we know that there will be people experiencing financial difficulties as well because of the impact on the pandemic response. So we'll move now to Leeds Making History. This will be with Lucy, who will take us through this now.
Thank you, Nadia. So yes, as Nadia said, I mean, it was actually the 24th of February when we first had our first case of coronavirus in Leeds. So we are almost exactly a year since that time. And since then, if we move on to the vaccine, over 184,000 people have been vaccinated in Leeds. That's 90% of the over 70s and 60% of those who are termed clinically extremely vulnerable. And you might have seen this in the news back in December when Leeds Hospital was one of the first of the 50 hospital sites chosen to start the Pfizer vaccine. And that first patient, you might remember her, Sylvia Harris, I think she was, 80 years old, a ward housekeeper, the first person. And it's amazing when you think now that's only 11 weeks ago. It's not very long ago. And it wasn't very long afterwards that GPs, our first primary care networks, which are groups of GPs working together, the first 3 had their first delivery, and you could start to get the vaccine in a doctor's surgery. Next slide, please. So how have we got that far, up to that 184,000 number? Well, because now all 19 primary care networks, so that's covering the whole of Leeds, every GP that you might be with is part of one of those primary care networks, now are delivering the vaccine. We also have now 2 hospital hubs, and we have 2 community pharmacy sites in different parts of the city, and then our large site, which is at Ellen Road. But what we want to do now is start to look at other options to make it easier for you to get the vaccine. And we're also starting to invite people that are younger in the 65-year age group. Our ambition is that nobody is left behind in this vaccine programme. Although I gave you some brilliant numbers earlier, there are still over 3,000 over 70-year-olds who have not had the vaccine. And if we look at people who are really vulnerable, then that's 28,000 people that haven't had it. We also know over the year that has just passed that COVID-19 has impacted different communities differently. Nadia mentioned older people and people with long-term conditions becoming particularly ill from the coronavirus. But people from ethnically diverse backgrounds, different marginalised groups, and those living in disadvantaged neighbourhoods have been really impacted by this virus. What we've been doing is working with community partners, with our local faith leaders from all religions, and with you, the people of Leeds, to understand how can we support people to make what we would term, I suppose, an informed choice, to make that choice about whether to have the vaccine with all of the information at your fingertips. Next slide, please. Over the last 11 weeks, what we've been doing is to try and improve access to the vaccine, looking at things such as transport and how you can get to your primary care network. What we're now doing is looking at more mobile sites. For example, we're planning a pop-up facility in a community venue. We're looking at community centres, taking the vaccine to the heart of the community. We've identified a roving vaccination team that can also go into specific areas, such as sheltered housing. And also a bus is coming. We've got a bus with a dedicated team that can come out to people. We have heard a lot of reasons why people haven't accessed the vaccine. And I think maybe some of the GPs might want to just give an example of what people have been saying to them. I don't know if Dr. Paul wants to give one.
Thank you, Lucy. Yes, the people from the ethnically diverse group and who are also like homeless, mental health people, they are mostly not coming forward. This is a call, we are calling it health vaccination hesitancy, but it's not really hesitancy. There is a genuine reason. They have some form of question to answer. As for example, when we started our vaccination in Leeds, our patient was one of the first third patient to start vaccination in the GP hub, East Park Surgery. And I was the first GP to get the vaccination on the very first day. My own family was not happy to go for the vaccination. My staff, my receptionists at my practice, they are not very happy. They had questions, they had some fears, they're scared. But when they saw that I got the vaccinations, then my mother-in-law, who is elderly, my wife, who is an NHS worker, my daughter, who is an NHS doctor, all thought, oh, my dad is taking the vaccine, he is okay, so let's take it. And my staff, our practice staff, they all signed up for the vaccination after seeing that I have taken. This is one of the things we healthcare workers we can do. We can tell the people that it is safe. We have to involve all these people who are influencing the family, the community, like Lucy said, the community, the faith leaders, but we have to approach the young group who has got mobile phone, who have got access to the social media, and they can influence the family. So what we are trying to do now, we are not telling that your concerns are not genuine. We're telling, yes, your concerns are genuine. Please look for the information. Please don't go for the misinformation. we are fighting two pandemic. One is pandemic from the coronavirus. Another pandemic is from the misinformation, wrong information, and other people who are really selling this information to us through the social media. That is called the conspiracy theory. So we are trying to now engage the people whom the societies trust, and that is the way we can get over this corona vaccine hesitancy.
Thank you, Dr. Hall. I think what we're trying to say here is that we don't want to judge, we want to listen, we want to understand, but we want people to make an informed choice. We know for many what it's about is it's not no, it's I'm not sure, I need to find out something more, and hopefully this session is part of that journey. I think I'm passing over to Dr. Sattar.
Thank you very much. I hope that you can hear me. Can you hear me, Lucy?
Yes, I can hear you.
Excellent. So I'm in Studio 2 of the FIBA headquarters, and they've been running a advertising this event, and they've kindly let me take over Studio 2 before my show that starts at 3 o'clock. So apologies about trying to get on, but as they say, there is no business like show business. So, so we've had a fantastic introduction from Dr. Nadia, Lucy, and also Amal Paul. And now is a really exciting bit where we are going to be answering some of the frequently asked questions. At the time of preparing for this, we made sure that the information is accurate, but I think it's important to acknowledge that this is a very dynamic situation and it is changing. The other thing to say is that we are unable to answer specific questions that are individual to a patient's case. And if you still have a question that you feel is unanswered, then you're still able to drop that into the Facebook Live and we will try to get back to you. If there is something that is more urgent, then I would say, please do not wait on this Facebook Live for us to help you with that. Either contact your local healthcare provider, or if it's more urgent, then please dial 999. So the way that we're hoping to go through this is to, we've selected the frequently asked questions, and the way that we've done that is actually listening to some of the events that have been happening over the past few days, and also listening to some of the forums around the city. From that, we've come up with some authentic questions. These are frequently asked, they are from the community, and we hope that you're going to find them really, really informative. So I think what we'll do is we'll move to our first question, if that's okay. And the first question is, what vaccines are approved? And this is going to be answered by Dr. Amal Paul, if I can invite you, please.
Thank you, Mo. When coronavirus pandemic started, we realized that this is a very unforgiving and formidable enemy to us. We lost hundreds and thousands of people, and we didn't have anything to fight against the virus. We just had the preventive measures like wearing masks, making distance, and washing hands. The scientists worked all throughout the world, and they got something for us to fight the vaccine, fight the virus, and that is vaccine. Different countries produce different vaccines. At this moment in the UK, we have got 3 vaccines approved. One is Pfizer, BioNTech, AstraZeneca, and Moderna. Although Moderna is approved, but we are not using, hopefully it will be available from March or April. The Pfizer BioNTech was the first vaccine approved in the UK, and AstraZeneca was the second one. Now, the Pfizer and the Moderna vaccine, they are produced on a new technology called messenger RNA technology. This is the technology for when the messenger RNA protein is extracted from the virus, and that is modified, and then they're injected as a vaccine. So our body recognizes that protein, and when the real coronavirus affect us or attack us, then this vaccine protect us. That is two types of protection we have from the vaccine. One is called serum, that is immunoglobulin, another called cell-mediated. So that is two type of protection it gives us. The similar protection gives the AstraZeneca, but it has a vector-mediated vaccine. It's an age-old process. Again, it doesn't have any protein other than this vaccine protein, and also Moderna has the same technology as the Pfizer-BioNTech. In summary, these vaccines they don't contain any animal products or fetal protein. There is no gelatin or alcohol. It has been declared by the faith and the religious group that they're safe. From the Muslim community, they say it is halal, so you can get it. Hindu community, they say that's fine, you can get it, there's no problem with that, as the Jewish community. There was some hesitancy among the vegan and vegetarian group, but they also come forward and approved the vaccines. So this vaccine does not have animal protein, it does not contain fetal protein, it does not have gelatin or alcohol, and they are approved by the faith and the religious community to have that. I'm making one point to make it clear for the Muslim community. The Saudi Arabia has declared that they will not allow anybody to enter Saudi Arabia for Hajj or pilgrimage who does not have the vaccination. So that again confirms that this is a halal and it can be used by the Muslim community as well. And also the vaccine is safe. We have millions of people had vaccine in this country, both from above the 18 until 100 plus people, aged people. And there is no serious complications we have yet reported. In Bangladesh, I know there are hundreds and thousands of people that are having vaccination, no such serious side effects reported. So in summary, I can tell you this vaccine is safe. It does not contain an animal protein or anything which you can think that is not indicated for your community. Please get it and it will save you.
Thank you for that really important information around what vaccines are approved and also the ingredients, and more importantly, that this is safe. Please come forward. Thank you, Dr. Amal Paul. If we move on to the next question that we have identified as being important, is one vaccine better than the other? And I want to invite Dr. Julie Aduodu to answer that question for us, please.
Thank you. So they're both safe and highly effective vaccines. For vaccines to be approved, they need to show that they're at least 50% effective, and both the vaccines that we're currently using have rates of efficacy, which is the effectiveness, that are in the high 80s and 90s. There hasn't been any trials for direct comparison between the different vaccinations that are available, but they do both. So when I say both, I'm talking about the Pfizer and Oxford AstraZeneca ones, which we're currently using in the UK. They both protect from serious illness from COVID-19 infection. And one thing to note is that when you're offered a vaccination, you'll be given whichever vaccination the centre or the place or the mobile unit has in stock. Because they're all being kind of distributed centrally, so that even the centre doesn't decide or determine what they have on the day, but everyone being vaccinated on one day will receive the same vaccination, and when you come for your second dose, you'll be given the same dose, the same brand or type of vaccination. So it's just to reassure people about that. And as has already been touched on by Dr. Paul, the vaccinations are safe. They've gone through extremely strict and rigorous safety, quality and effectiveness protocols that are internationally recognised. In the UK, we have the independent MHRA, which stands for the Medicines and Healthcare Products Regulatory Agency, and they have been reviewing all of the information, working incredibly hard as part of like a rolling review of the information as it's become available to quicken the process instead of waiting for the end of the clinical trials to review it all. they do this for all medicines and vaccinations, not just for this, and they're applying these strict and rigorous standards to all of them. And it's also really reassuring to know that prior to approving the vaccinations, over 20,000 people had received them. So they had a vast amount of data of safety and effectiveness and the quality data from 20,000 people. And just to put that into context, that's for each vaccine. Often for vaccines when we're more familiar with, such as flu, you might just have about 7,000 to 8,000 people tested within a trial. So they did over 20,000 for each of these ones. And just briefly to touch on side effects, you can potentially have side effects to anything, even paracetamol, which is a common household, covered medication. But the common side effects to the vaccinations, as you'd find with quite a lot of vaccinations, may be pain in your arm. It's currently mainly given in the arm. So you may have localized pain for a day or two, just when applying pressure to the area. You may have experienced some tiredness, some fever, headache, mild flu symptoms, or you may not have any side effects at all, and the vast majority don't, or if they do, they're very mild.
Thank you so much, Dr. Julie Duodu. We're going to move on to the next question that we've identified, and I'm going to hand over to Dr. Nadia. And this is a really important question. We are seeing a lot of people ask and are genuinely very worried about this. And so I'm going to hand over to Dr. Nadia. And this is around, can the vaccine affect your fertility? Thank you.
Yes, thank you, Mo. This is something, when I've been vaccinating and when I've spoken to my staff at the GP surgery and family members, this is, I would say, the #1 question that I have been asked. So as Mo says, it's a really important issue. So what the medical experts and scientists, they all agree that it is not possible for the vaccine to affect your fertility. So it does not affect your ability to get pregnant. We know that there is no evidence and there is no theoretical reason. There's no sort of connection as to how this would happen. So there's no theoretical reason why the vaccination for COVID-19 would change or make any difference to your ability to get pregnant. So the immunity, as Dr. Paul has sort of mentioned, what we're doing is we're asking your body to make some immunity, and the immunity or the protection that you develop is to the spike protein. And this does not seem to have any influence at all in your ability to get pregnant. And we now know that lots of people in the UK sadly have had COVID-19, and there doesn't seem to be any evidence that those people who have had COVID-19 have any additional difficulties to get pregnant or conceive. So a really important question, and I hope I've been able to reassure you that if this is something that you are worried about, that the COVID-19 vaccination does not have any influence on your ability to get pregnant. So we know that initially lots of medicines are not recommended for women who are pregnant or are just trying to get pregnant. But that's very common with all new medicines. But the position has now changed, and we are offering the vaccine to some women who are pregnant, who we know have a higher risk of serious illness from the COVID-19. And we know that at the end of pregnancy, some of those sort of effects of the virus can be very serious. So if you are invited as a pregnant woman, if you meet the criteria, it will be safe for you, for those select group of pregnant women. Thank you.
Thank you so much for that reassuring message around fertility, Dr. Nadia. That's really, really fantastic. Thank you. Let's move on to the next question, which is also one that we've heard a lot about. And this is about how were the vaccines developed so quickly, and no other than our public health expert to answer that. So over to you, Dr. Lucy Jackson. Thank you.
Thank you. And I can completely understand why people are asking this question. You know, normally vaccines do take a long time, and there are, for some diseases, we haven't found vaccines. So yeah, they have been made really quickly. But I think there are 4 really good reasons for that. The number one, and the main one I would definitely put forward, is funding. The whole country, the whole world, the global effort has been behind developing a vaccine. So the funding has been unprecedented in terms of supporting that effort. Secondly, I think I'd say it is because we've worked together, we've worked collaboratively across the UK, but also globally in terms of developing the vaccine. Normally it's a competitive thing between different companies in terms of developing vaccines. So this has been a real collaborative effort. And thirdly, I'd say probably because we have streamlined processes. I mean, I would stress they've still had the 3 phases, the 3-phase trials that we always have in terms of developing a vaccine. So it's not about making shortcuts, but I think it is about the fact that they've streamlined how they've done it compared to when we've made vaccines before. And that's, again, because we've all been together in this fight against COVID. And I think the last one is very much, I think Dr. Julie mentioned it earlier in one of the questions, often with clinical trials, it's quite hard to get lots of people to come forward and be volunteers. This was been very different. Lots of people have wanted to come forward to be volunteers for these vaccines. And we've had a high infection rate in the community. So you've had the perfect kind of circumstance to really develop this quickly. So that's what I'd say.
Thank you so much. Thanks very much. Let's move on to the next question. And do remember that you're still able to submit questions if you do have them, and we've already had a few come in, so thank you for that. We do want to make this as relevant and as interactive as possible. The next question is around why are ethnically diverse people being asked to get protected? Let's invite Dr. Amal Paul for that, please.
Thank you, Mo. I think when the vaccination program started, we tried, and the aim was to vaccinate everybody, irrespective of ethnic origin, color, creed. Everyone should have vaccination. This is the policy, because we may see different color, different ethnic origin, but coronavirus doesn't. Coronavirus is not racist. They can affect anybody. So we wanted to protect all the communities. Now, ethnically diverse people members, and also the people who are clinically extremely vulnerable, including the people with the mental health illness and who have no fixed abode, they're at high risk of having infection, not because of their any other ethnic origin, maybe because they're living in a multi-generational house, in poverty, and they may not be as much maintaining the other safety measures as the others are doing. So this is not the case that we are asking only the ethnically diverse people to come forward of vaccination. We are asking everybody. The ethnically diverse people are more encouraged to come forward because the rate of death and risk of having serious morbidity is higher in ethnically diverse group of people. As for example, if an African woman is pregnant, she is at 5 times higher risk of dying from the pregnancy than the white women. It's not their fault, but this is the outcome of the infection. That's why people are asking ethnically diverse people, BMA community people, please come forward and have the vaccination. This is to protect them. This is to protect the whole community. And we know that there's a hesitancy. And yesterday, there was a program we showed that in ethnically diverse people, 80%, in between 70 to 80% people, they think they will decline the vaccination in comparison to 20 to 30% in the white people. This is something worrying, because we, the ethnically diverse people, are dying more, having more infection, and we are reluctant to have the vaccination. So there is a double whammy. There's more infection, less vaccination. We are putting ourselves at risk. That is one thing we need to keep in mind, that at this moment, the vaccination is, we have the weapon to protect ourselves, and we have to come forward. So this message is, please, please, if you're invited for the vaccination, get it.
Thank you, Dr. Paul. We'll move on to the next question. And this is around, can the vaccines make you ill or give you COVID? And that, I think, is over to me to answer. And I can emphatically say to you that the vaccine cannot give you COVID-19. To build up immunity after vaccination can take a few weeks, and you may have COVID, come forward for your vaccine, and then develop the symptoms of COVID-19. But the actual vaccine itself cannot cause COVID-19 at all. The other thing to say is that it's not a live vaccine, certainly the two that we're using at the moment. And the final thing that I would want to say is, can it make you ill? Well, as you mount a response to, for example, the flu vaccine, there may be some mild side effects that you may have, but it certainly will not cause COVID-19. Thank you. We will move on to the next question now. And this is around, not everyone is told to have the flu jab. So why is everyone being told to have the COVID-19 vaccine? And this is over to Dr. Julie Duodu, please. Thanks.
So my kind of response to this is that we're in a COVID-19 infection pandemic. So all adults have been invited to have the COVID-19 vaccination in time, because they're in the pandemic, because we're all potentially at risk. So those who are currently offered the flu vaccination are people who are either thought to be high risk personally, or people working with people or patients who are at high risk of developing serious complications from flu. So that they're two quite different things, and with both of them you're being invited to have them, and it's not been mandated, it's been offered. And the COVID-19 vaccination is a safer way to build up your immunity. This has already been very eloquently explained how that happens, but in short, we're trying to teach your immune system how to recognize and be ready to fight off the infection by introducing just one of the 25 proteins that makes up the virus. So your body can recognize it before you're infected, so that you're ready to try and ward it off. And by doing that, it helps to reduce the chance of spreading the virus. If you have a lesser infection, it could be mild, it could be shorter, and then you're less likely to pass it on to others. And I think that's what a big thing that a lot of people are concerned about. I know that I'm very concerned about that, passing on to family, friends, vulnerable patients. So that's the benefit of receiving the vaccination. It's not just for yourself, it's for those around you and the wider community.
Thank you very much. This is over to Dr. Paul, and will the vaccines work with the new strains? Very relevant given the headlines around hair hills. Thank you.
Yes, the viruses, they have got potential power, we call mutation, to change their body form. In the coronavirus, there are some spikes. In the spikes, there are protein. And thereby mutation, they change the character of the protein. And the vaccines are made to fight with the proteins which are in the spike. As for example, the virus we saw in Wuhan in November, December 2019 are not the same virus we found in UK in March, April 2020, and now in 2021, we have some other form of the viruses. Now, when a vaccine is produced, they have multifaceted. See, the small mutation of the viruses can be overcome by the new vaccines. And also, as I said, there are two types of protection of the vaccine. One is immunoglobulin, and other one is cell-mediated immunity. As far as we are concerned now, the scientists, they found that although there is variation and although there are mutation of the viruses, the vaccines available, they are quite effective against the infection of the coronavirus now. Well, like South African variant, they have got more potential to spread. They can be more dangerous to have, and they can kill people. But at the same time, these viruses can be neutralized with these vaccines. There is a body, scientific body in the UK and all over the world. They are constantly watching the nature of the mutation of the virus, and they are making some changes in the vaccines. And you'll be pleased to know that we already heard from the Oxford Vaccine Centers that they are trying to modify the vaccines so the new strains this vaccine can be used against the new strain. So yes, the vaccine which we are using now, they are at this moment found to be effective against the new strains.
Thanks, Dr. Paul. And I'm sure time will tell. As we've said, the information that we're giving today is correct at this point. And of course, things will move forwards. We'll have more information. It is a dynamic process, and hopefully more good news on the way. Should people who have already had COVID or are suffering from long COVID get vaccinated? This over to Dr. Lucy Jackson. Thank you.
Thank you. Well, I could just say yes, which is the short answer. If you're in one of the groups that has been called up, if you're one of the groups that we're already targeting at the moment, the regulatory body that we mentioned earlier did actually look at this specific question, and they are very clear that it is just as important for people who have had COVID to have the vaccine. We don't know how long antibodies are with you after you've had COVID. There's different research which is showing us maybe 5, maybe 8 months, but it's definitely important, even if you've still got mild symptoms, to have the vaccine. The one thing I would say is just a word of caution, is that if there is somebody with long COVID who is still experiencing significant complications, then that should be discussed with their clinician, whoever's looking after them, rather than just going for the vaccine. So if that's you, please have a conversation with your doctor. And also, if you do have symptoms yourself now of coronavirus, then please get a test before you have the vaccine. And then if it is positive, wait until after the self-isolation period before you actually go forward for the vaccine. But overarchingly, the answer is yes, Mo.
Great, thank you. So really thorough answer there. Thank you very much. Well, I need to be vaccinated before I can travel abroad. I know that everybody is missing the sun. So this is an important question, actually. Over to you, Dr. Nadia.
I seem to get the fun questions, don't I? I mean, as Mo says, it is something that I think a lot of people have wanted to travel, and not just for leisure reasons, but for other personal reasons. And Dr. Paul did also mention so those people who go on religious pilgrimage. So it's a really important question again. And at the moment, the UK government, at least, has not sort of said that you have to be vaccinated before you travel. However, it is a dynamic situation again. Some travel companies and perhaps some other countries also have asked that before you travel, you may need to show some vaccination documentation, whether a passport or whatever. But so there are some travel companies that have brought this in. So it's a changing situation. But at this moment, the UK government doesn't require you to have the vaccination. But it may well be something that you will have to consider if you wish to travel in the future. So that's it from me, I'm afraid. can't help you with the holiday choice.
Thank you very much. Great. So the so-called COVID-19 passport, certainly not in the UK for the moment, but let's watch this space. Thank you. Thank you very much. And the next question is, why do people still have to follow the guidance, which is hands, face and space after having the vaccine? This over to Dr. Lucy Jackson again.
Thank you. And I think this is really important. But again, you can really see why people think, oh, I've had the vaccine, I don't need to do any of that kind of guidance anymore. But what we know and what we've said earlier was that the vaccine has shown that it can protect you against being sick, being seriously ill. And there is some data that's starting to come, and we keep saying this is at this point in time, there is some data that's starting to show that it can stop you infecting other people, but this isn't 100% and it's only just emerging. It's still, as we all know, everything, it's still really new. So therefore it's really important that you do continue with the hands, face, space. I would add ventilation, and I think there's a new poster or something that has that on. So wash your hands, cover your face, keep distance. But the ventilation is particularly important, I think, at this point in time, because lots of us are indoors. Open a window, open the door now and again, let some fresh air in. We know that's really important. So yeah, sorry, please keep to the guidance.
Absolutely. Not forgetting that really, really important advice there. And the way that I view this is actually be a good citizen. Which is what we all want to be, and whilst the face covering can be uncomfortable for people and it's not what we would normally do, it may reassure your fellow citizen, and so taking that into account will really help reassure everybody around you and also protect yourself. That was the last of our pre-prepared authentic questions that we have prepared for today, and like I have mentioned, you're still able to submit questions. We've got about 15 minutes until the end and until we conclude, and we have had a few questions coming in, and the way that I want to go on is just to pick a few of those questions and invite some of our speakers to move forwards and answer some of those for us. We do have Dr. Amal-Paul who wants to answer the question that we've had around lupus attacks and also whether or not they can have a vaccination. So Dr. Amal-Paul, the question is, I have lupus which attacks the liver and I worry about having the vaccination.
Oh, thank you. Can I go back to the basic thing about the corona vaccines? Corona vaccines are inactive protein. They are not active virus. They cannot replicate in the body. They cannot attack any cell. Only the proteins that produce a response for the immunity. The most of the people who has immunodeficiency problem, including lupus, they are at risk, higher risk of having coronavirus infection. And if they have the infection, the outcome may be serious. The common advice at this moment is the people who had immunodeficiency syndrome and also having some treatment, including chemotherapy for the cancer, they should consider the vaccination, the coronavirus vaccination. However, if you have active liver problem due to lupus infection, it will be a good idea to talk to your specialist or your GP before you go for the vaccination. But if it is not active one, that is no contraindication at this moment for the vaccination. But if, as I say, if you have any concern or you have active liver problem, you should discuss with your GP or your hepatologist.
Yes, thank you, Dr. Amal Paul. And certainly from my experience, both secondary care specialists, your consultants working with GPs at the moment to make sure that we've got a coordinated response and make sure that we are offered the vaccine, the appropriate one, and also at the appropriate times. Thank you so much. Let's move on to the next question. This is from a fellow a university student who's asking the question, are university students able to have the vaccine? And I've got Dr. Julie Dodu who wants to answer that. Thank you.
Thank you. So at the moment, the vaccine has been rolled out in terms of certain groups that are felt to be more vulnerable, either due to age or conditions or a combination of the few. So there isn't at the moment a plan to offer the vaccination to all university students by virtue of being a university student, but you may be invited if you have underlying health conditions, if you, as part of your studies or work outside of your studies, are working, say, in health or social care, and this mixing with vulnerable people, and you may be offered the vaccination as in those instances. But at the moment, university students are not being offered the vaccination by virtue of being a student. That's not a cohort that's been kind of selected to be prioritized for the vaccination. But as I mentioned, in time, all adults will be offered it. There's a rolling program to try and achieve that, but we're trying to offer it to the most vulnerable or people working with the most vulnerable in the first instance. So I hope that helps answer the question.
Thanks, Julie. I do want to sort of add that if you are a university student and you're not in physically in university, and you have an interest in volunteering, then there are loads of volunteer opportunities across the city in vaccination sites. So that may be something that you want to consider. Do come forwards or contact your local vaccination centre, whether that's GP or Ellen Road, etc. And I'm sure someone will be able to help offer a volunteer opportunity so you can actually see how the vaccination program is rolling out. Thank you so much. We do have another question, and this is around other health conditions that mean that you can't have the vaccine, and also is AstraZeneca okay for over 65s to have? That over to Dr. Nadia. Thank you.
Thanks, Mo. Just taking myself off mute there. So yes, the first question is or the second part of the question about over 65s and the AstraZeneca vaccine. So I think around the world, people have, or different countries have a slightly different view on this, but certainly in the UK, the AstraZeneca vaccine is authorised for use in all ages. So at the moment, we are using it in all ages. And because the AstraZeneca vaccine is more easily sort of moved around, we are actually using it for our elderly housebound patients, and quite often in our care home patients, who again, a large number of those will be very elderly. So it does have some advantages over the Pfizer vaccine, just in terms of actually getting it to people. So it is safe, as we've said, and it is effective in people who are over the age of 65. And as Julie did say earlier on, when you are called to have your vaccination, there won't generally be able to choose which vaccine you have, because it will definitely depend on what the vaccination site has received in terms of deliveries. So at the moment, most people will not be able to specifically choose which vaccine to have, but we will try to get the most appropriate vaccine to everyone. There are one or two caveats, as always, and I would say that, you know, my information is not sort of covering 100% of everything, but certainly we don't vaccinate people who have had severe anaphylaxis, the most serious type of allergic reaction. We avoid using the Pfizer vaccine for those people. So that may well be a reason why we would choose to give the AstraZeneca vaccine as a way. But in general, you know, that we don't do that. And then in terms of age, we do have some people who are vulnerable, who are maybe 17 and under the age of 18, and we don't use the AstraZeneca vaccine for those. We use the Pfizer vaccine because that has the approval to use it from 16 and above. Thank you, Mo.
Thank you. Thanks, Nadia. I think we've got a couple of questions. I'm just bearing in mind that we're coming towards the end now. We could probably take those two questions. There is a question around pregnancy and fertility. But what we've said is it may be that person has joined sort of midway through or missed that question and the answer to it. So I'll take this opportunity to say that this Facebook Live is available for you to watch and catch up. So if you're able to replay the session, and actually I would urge you all to invite your friends to do exactly the same. I may well actually play the audio of this on a forthcoming show of mine at Fever as well, and make that available. So you can watch this again, and I would urge you to do that. And let's get this Facebook Live out so that the information is out there, so that actually people can make a really informed choice about the vaccination and their preferences around it. I do want to end now by sort of letting you know where you can get the information that you can trust. And there are several ways of doing that. Obviously, all the social media outlets, we are on Twitter, we are on Instagram, we are on Facebook. You can contact the nhs.uk/COVID vaccine website. You can also look at the Leeds CCG .nhs.uk/COVID-vaccine website, where we do have videos in formats and other languages, and also frequently asked questions are answered there. I would say that you should verify before you amplify. And I take that from Kari Yasim, who has written about that and often says that, and that is that, and we've all echoed this today, which is that the information that you have, you need to make sure that it's from a credible source. And that's one of our motivations for being here with you today, to give you the information that you can trust. So please do take a moment before you hit that forward button on WhatsApp to make sure that you ask yourself, where is this information coming from? Can I really trust it, before hitting the forward button? And the other thing that I would like to say, if I just have the next slide, please. Is that there are 3 ways that you will be invited to your to have your vaccine. Again, this is a dynamic process, and you will now see that lots of surgeries and providers are using something called AccuBook, and that is a automated text type service that you are asked to book in through. And so your local GP surgery is one way that you will be invited. Your local hospital may be another way. And finally, there are the vaccination centres. And I'm really, really pleased that Dr. Lucy Jackson's working on the mobile unit that hopefully will be moving around the city. And I'm really, really excited about that, taking the health to communities that really need it. So really congratulations to the team behind that. Well done for that. I hope that today has been really, really helpful for people, and there's some really rich information there that has answered some of the questions that you may have. I want to thank all of our panel today who have taken some time out, all jobbing doctors who have joined us today. Let me name each in person. Dr. Julie Duodu, thank you so much. Dr. Amalpal, thank you. Dr. Lucy Jackson, thank you so much. And last but not least, Dr. Nadia Anderson, thank you so much for joining us all today. There will, of course, be more Facebook Live events that we will do in collaboration with the NHS Leeds and possibly Leeds City Council and other partners. I want to thank everybody for joining us today. Do remember that you can watch back via the Facebook links there. You can continue to ask questions and we will answer those if we can on the Facebook Live. And we will meet again. Thank you very much.